Well, good afternoon and welcome to the COVID-19 update webinar. All attendees are muted for this presentation, but we do encourage questions and you can type your questions in by clicking on the Q&A box, or if you'd prefer to use the chat box in the lower part of your webinar window. This webinar is being recorded and should be out by next week. Thank you again for joining us today, and now I'd like to welcome Jamie Bowden.
Thanks, Mitch. Much appreciated. And if you want to move on to the next slide, like Mitch said, we are recording this and we've been posting these check-ins on the WASAC website shortly after, so you can access these in the future. And remember that handy chat box and Q&A feature for when you have questions. Today we have two guest speakers. I'm really excited to hear from both of them, to hear kind of what's going on and some future plans moving forward. We're going to provide just a brief update on the county variance. For those that just finished with the governor's press conference, it might be a little bit redundant. But just a little update on what's going on there. And then we just have some very general COVID updates as well. So we'll be hopefully very, very brief in what's going on. So next slide. So our first speaker, and hopefully she's on, I didn't see her name in the participant list, is Speaker Lori Jenkins. She is our House Speaker this past session, and she represents the 27th District. She also has a little bit extra knowledge in that she also works for local public health, and so she's kind of wearing multiple hats and has multiple lenses as COVID has kind of happened in our state and across the country. So with that, Speaker Jenkins, if you are on the line and can unmute yourself, I'll let you take it away and just kind of give us the scoop of, you know, what's the next steps that the legislature is thinking about. We've heard a lot of rumors around special session. I'm curious to see, you know, what intel you can provide there, and, you know, where we might go from here looking into the future for the rest of the year, as well as kind of in preparations for January next year.
And we don't have Speaker Jenkins that I'm seeing on the list right now. If Speaker Jenkins, if you're on the webinar, you can use the raise hand icon if you're using the calling in through a phone, and you can press *9 to raise your hand so that we can then unmute you if you're calling in through the phone system. There we go. And you should be unmuted now.
Hi, thanks. I'm learning all kinds of different things about technology through this, which is good because I'm not the best at that. So I'm happy to be on the call, and you know, I mostly am going to be interested in the questions that you all have, but I can tell you what I know about special session, which is, I don't think we really know. We will have a special session. I do not think we know when we will have a special session yet. I think there's a few things that we're looking at. Obviously, revenue forecasts and budget issues will be something that'll be very important to us in terms of talking with the governor about when we ought to have a special session. I don't think we have an official revenue forecast coming this month. We had an unofficial kind of projection earlier this month, actually just last week, which showed that right now, just in this fiscal year, which ends June 30th, we would be down about $700 million, which, you know, I don't know how different people look at this, but for me, that's very troubling, since we would have started at the end of this last legislative session, which was just in, you know, the beginning of March. We had $860 million that we had held back in reserves, And so it means that we would have gone through that plus another $700 million. And then looking through the rest of this biennium, which would end in June of 2021, the informal projections were that we would be about $700 million, $700 million this year, and then we start to get into the billions, and $7.5 billion in the whole the end of this next biennium. So obviously that's a very troubling data point for us. I think but then we also are looking at what the federal government may or may not do to help states, just like larger counties, Pierce and King, and I'm not sure which others, if Spokane and Snohomish got direct payments in the last couple of weeks, but I know Pierce and King did. So there may be some opportunities for states to receive some federal funding. And I think I'm just signing on to a letter today from Western states asking for $1 trillion to come to states. So that, we want to see what that's going to be. We want to see how the reopenings are. We want to see what the official revenue forecasts look like. And then the other thing that we're also paying attention to is if there are policy issues that absolutely have to be taken care of before the January 2021 session, and keeping track of what those are, so that would also govern whether or not we want to have a special session. So I guess I would say absolutely we're going to have one. When we have it is the question. And then just for us, one of the other primary issues that we have to think about is what kind of convening we do, and whether or not we convene remotely or in some sort of socially distanced way, or if we need a larger space so that we can be appropriately socially distanced to convene. So all of those are things that we're talking about. We are also just in the House, we're working a lot on economic recovery and actually on a whole bunch of topics, everything from, as I said, economic recovery to we have, a member who's leading us on healthcare issues and on K-12 issues. We've been very involved in the broadband issues and internet access issues, and have really, Zach Hudgens and Mia Gregerson have done a great job, I think, working and trying to help leverage what we've got in the state right now to try and get more access out there across the state, especially for our students who are trying to learn at home right now. We have a lot of members who are working on food issues and other things. So we're doing that kind of quietly behind the scenes. I'm quite aware that I think counties are starting to see really significant financial hits right now as we speak. So you all are trying to figure out what you do, and such a large portion of your budget goes to criminal justice systems that we're going to have to think very carefully about how we are able to help counties. I know one of the things we're already working on for whenever we enter into our special session is probably some sort of bill related to suspending kind of non-supplant language for local taxing options, which I know is something the counties and cities have been interested in. So I'll stop there and just be open to listening to other comments and answering questions that people have.
Great. Thank you, Speaker Jenkins. Much appreciated. And I think let's wait on questions, and I'll turn it over to our next speaker, House Minority Leader J.T. Wilcox from the 2nd District. So Representative Wilcox, great for you to join us on the call as well. Interested in hearing your thoughts too.
Thank you very much. And, we're probably thinking a lot of the same things. it in some ways would be good to not need a special session, but I agree with the speaker. That is going to be required. There's going to be, I think, some major budget adjustments. But I think I feel two things as well. First of all, it probably is harmful to do it too early because there are so many unknowns right now. And I think that a sense of legitimacy for our government that people can have confidence in is really critical. And so if and when we do come in, we would want to do it right and do it when we have as many answers as possible. And I think that the speaker and I are thinking about some of the same data points, a more solid look at what the revenue forecast is going to be, a more solid understanding of what county requirements are going to be, and a really solid understanding of what is coming from the feds. And I think that there's a great deal of danger in this. Now, I'm not an economist. I was a history major at a Cal College, but it seems to me that it's going to be really, really difficult for the feds to not grant a lot of the requests that will be coming from the states for massive financial aid. And we've already put trillions of dollars into this. I'm sure that there are more trillions to come, and nobody knows if the rest of the world, for example, is going to help finance the operations of the United States when they are also in crisis. And we know that a lot of our deficit has been financed by foreign investment. And if that doesn't happen, then it's a matter of printing money. And no country, no dominant country like the United States in the history of the world has ever abruptly experimented with expanding money at the rate that we will likely have to do that. And we're all going to be part of this experiment. And I think we all have some responsibility to try to do this in a way that has the least possible consequences. I've had some differences with the governor in how we go forward with this. And, I really honored his resolve at the beginning of this to take those tough steps. And I've said that publicly, but as time has gone by, I also think that we have to get better at doing more than one thing at once. And we need to do whatever we can to preserve as much of the economy that we possibly can and do it safely at the same time. And so I think our caucus is perhaps a little more wrapped up in, first of all, listening to the desperate people in our districts and their worry about their own economic well-being and trying to help them navigate through the programs that are available and understand what the rules are for the stay-home orders that have been issued and modified in some cases. And at the same time, really trying hard to influence a conversation about how can we look at those things that can be done safely and do them on a more rapid schedule. And I think a lot of us have been around the business world before. In the legislative world, time doesn't matter that much. One of the most common things on earth, and many of you have experienced this frustration with the legislature too, is if we don't get this bill done this year, we can get it done next year. But so many businesses, I've said this before, a day closed or a day off from work is not good. A week can feel like a disaster, and 2 or 3 months can be a catastrophe from which the staff members and the business itself will never recover. And that, I think, is really, really eating at the members of my caucus. And we get a little frustrated with the governor when he doesn't seem to have the same sense of urgency. Although at the same time, it's true that we're moving more in that direction, and I do appreciate the moves that have been made. And we absolutely understand that it has to be safe. We also have, I think, some frustrations with the fact that it's really hard to access the programs, but I don't care whether you're in the public sector or the private sector, when you have the kind of growth and demand for signing up on the website for employment security, you're going to have a challenge with that. And we really want to help people navigate that without any disastrous consequences to them because they can't access the dollars that are necessary to pay their bills. We're also, I think, pretty concerned about the downstream impacts of, for example, so many people who aren't able to pay rent. And what is that going to do to the supply of housing down the road? Because, you know, people have financed these rental homes. They're going to be in default. Does that mean that we're going to have a lot of vacant buildings because of default and then foreclosure? Does it mean that nobody is going to be financing the additional housing that we need in the future? These are consequences that we have to work through. And I think a lot of you at the county level, you have to deal with problems that are a lot more concrete a lot of times. And you are judged, I think, much more harshly than politicians at the state level are. And we should be talking, I'm sure, a lot more than we already are about how do we mitigate the economic consequences that are coming down the road at the same time as we're dealing with all of the health consequences. And we know that part of the consequences are going to be new kinds of health challenges or exacerbated challenges because we have also shut down a big part of the health system. And we are hearing constantly from medical professionals whose practices are at risk financially now. And we can't allow all the things that we depend on to collapse as we deal with this disease that is serious. I don't like it when members of my caucus are painted as people that don't care about the human impacts of the COVID crisis either. We just care an awful lot about the other crises that are impacting people's lives. When we get into the special session, I think that it would be, and the speaker and I have talked about this, we would hope that since it will be a special session under emergency conditions, that we be as constrained as possible in the things that we are addressing, so that we are addressing the policy issues that are necessary due to COVID. I think it would be unfortunate if the public was treated to either side trying to implement their agendas, or either side using it as just a platform for ranting. And so I really want to be sure as we go in that we have that kind of control. And as a member of the minority, who probably is not going to get a whole lot of what we want, we do want to share with the public. We care about the result, and we care about being part of a process that they can trust. So that's it for me, and I'd be happy to help answer questions too.
Wonderful, Representative Wilcox. Thank you so much. To kind of start us off, I have a question around, or more kind of an open-ended question around OPMA and Public Records Act, and just kind of both of your thoughts on how to handle it as we move forward. A lot of our county business, particularly the business that our commissioners do, really rely on these two acts and those extensions. Any flexibility in the normal and necessary work requirement OPMA, just kind of your thoughts about that moving forward. And perhaps Speaker Jenkins, I'll let you answer first, and then Representative Wilcox.
Thanks. I have been, very supportive of the governor's proclamations, and this one in particular. As you mentioned, I work in local health in my other job, and so it's a struggle to figure out how we actually have a Board of Health meetings and really engage the public. Although I would say, I think that, for me, the proclamation on the Open Public Meetings Act actually probably allowed more access to to Board of Health meetings than we had for a long time, because people could call in and listen to those, and we weren't doing that. You had to come to the meeting itself if you wanted to participate in a Board of Health meeting before that. So I actually think there's some really good parts about the proclamation and the loosening of the Open Public Meetings Act. The other thing is that it does narrow and limit what you do, right? It has to be regular and necessary work. So I think there are good protections there. I would have extended the proclamation longer than it was, but each of the governor's the way that these governor's proclamations work is that there are proclamations such as stay home and stay healthy that don't have statutory implications, but others that do, they might kind of stretch a statutory standard or alter a statutory standard. Those, the governor can issue a proclamation for 30 days under an emergency. And after that, either the legislature, if it's in session, has to extend the proclamation, or if the legislature is not in session, the four corners have to unanimously agree to that. So each of the proclamations that we have extended, they're extended for the length of time that the one of the four of us, or two of the four of us, or whatever, three or all four of us, but whoever agrees to the least amount of time, that's the amount of time that we agree to, because all four corners need to agree to that. So anyway, I've been very comfortable with this proclamation in particular, because I think it does continue to protect public access to decision making and to information, and I think that's what's important. And it does that while keeping people safe.
Great, thank you. Representative Wilcox.
Sure. That proclamation had a lot of parts to it, and unfortunately, you have to say yes or no to all the parts. And we would like to work a little bit more, not on the open meeting part. We were fine with that, but there's also a little bit of exception to public records. And, there was an awful lot of, anger, distrust, and finger pointing a couple of years ago about PRA and the legislature. And so we agreed to a much shorter term extension with the request that we work on the public records part of that to see if we could get rid of or somehow modify the changes to public records. There was so much political capital expended in that public records argument that it just didn't seem right, especially at a time when we're being governed through emergency orders to not be as absolutely open as we can. And I don't think that there's any nefarious intent in that. We just would like to have some conversation with the governor's office so that maybe we can go forward with a different order that would preserve more of the public records ability.
Great, thank you. Just a reminder to type your questions into the chat box or the Q&A box. Much appreciated. Back to the revenue, Speaker Jenkins, and thank you for that. We absolutely, I know as counties, look forward to working on addressing our budget shortfalls. I know, my normal job is to wear my public health official's hat for local health jurisdictions, and they've been on the front lines of this since January. And I know our commissioners are looking at the upcoming budget season and just have a lot of anxiety of that. So just really want to reinforce and thank you for your willingness and the legislature's willingness to to work with us on that revenue shortfall.
Well, just like everything else related to this, we're all in this together. We will rise and fall together. This next legislative, the special session that we have, and any other special sessions we have, and next session are going to be very challenging in ways that we maybe have never been challenged before. But the best thing that we can all do, I think, is make sure that we're taking steps forward while not taking steps back, right? So that's why it's so important in the reopening phases, this phase 1 that we're in. It's really important that we do things right so we can actually move to phase 2. So it means that we've got to encourage people to keep on with the social distancing. And we have to make sure that we're paying attention to the data points and to investing in the contact tracing that was discussed, because that's where we are not until there's a vaccine and a treatment for this, because even vaccines are not going to be 100% effective. They never are 100% effective, and that's the wrong standard to set. So that means we're going to need treatment also. So until we get those things, we are going to have to use everything that we've got within our power. And I really think, the social distancing work, the hand washing work, and all of that we do is the best thing that we can do to prevent this disease. So we've got to do all of that while we're reopening and realize that it's pointless to take one step forward and then 2 back. That our economy is never going to recover if that's the approach we take to this, is to just go full speed ahead without regard to controlling the disease. So this is about balancing our reopening with controlling the disease. And I think that's what's going to help us come out of this more strongly. But there's just no doubt that we're going to be in a really difficult position for at least the next year, if not longer.
Great. Mitch, do you see any hands up or anything for folks that would like to ask a question?
I'm not seeing any hands up at this time.
All right, why don't we try unmuting everyone and see if anyone would like to ask a question.
I can only unmute 20 at a time, I believe.
Okay.
But have them, if they're on the phone, press *9 to raise their hand, or they could use the raise your hand icon, and they could ask that could indicate to us that they want to speak, and then we could unmute them from there.
All right, that sounds perfect. You've heard the directions from Mitch. Oh, we have a question. A comment: the 3-week cycle without a new COVID case is not realistic. Yes, I think we will touch on this later in the conversation. So hang on to that thought.
And it looks like we have 1 hand raised.
All right.
Gary, you're unmuted. Gary, are you there?
Yes, I am here. Can you hear me now?
Yes.
Thank you.
Good.
Do you have any insight at all on the pending contract, whether it's been let between the State Health Department and Abbott for the serology testing? And what I'm getting to is, where do they plan to have the surveys done? Do they already know which counties they're going to be targeting for the serology antibody testing? Do you have any information whatsoever on that? Thank you.
Go ahead, Lori.
Go ahead. Well, I mean, I don't have any information on the actual serology testing except for the public health advice that has been consistent and that remains consistent, that it is not a wise, if the serology testing is for our research purposes, then that is something that we should probably do. But right now, I mean, I just got off a phone call with physicians and other public health experts saying, here's the thing, you can test for antibodies as much as you want, but if we don't really know what level of antibody protection actually protects somebody, then there is no, you cannot use this to release the economy, to release people to return to work, to do anything. There's not enough known about the testing. So if it's research, then great. If people actually think we're going to use serologic testing at this point, right now with what we know to return to work, that is contrary to every public health expert, I believe, that I've talked to and that I've read information from.
I think that's the answer. Similar answer I would have provided as well. I think that's still an ongoing conversation with Department of Health and local public health that we will continue to update, and your health officers probably are able to provide more information on that. Any other questions for our speakers?
It looks like we have one more hand raised. I don't know who it is. It's a phone number. So if you want to identify yourself after we unmute you, that would be great. And you're unmuted. Phone number ending 2759.
That could be Gary Edwards. Can you hear me?
We hear you.
Oh, okay. Well, somebody raised the question about the 3 weeks is not realistic. So is there any thought about adjusting that? Because if we never get to the 3 weeks, does that mean we're perpetually in lockdown?
So as our guest speakers are legislators and not specifically public health, although Speaker Jenkins does work in public health, I don't know if they're best equipped to answer that question, Commissioner. So why don't we put a pause on that one?
Okay.
I mean, Jamie, I'm happy to just add a little bit. You know, there were 5 counties that were open today under these standards, I believe, that moved to phase 2. And I think it was done under the variance request as outlined in the governor's guidance. So I'll just say, when I first saw that 3-week standard, I actually told the governor, well, why don't you just say you can't have a variance because no one's going to achieve it. So I was actually surprised myself to see that counties had, and there are apparently another couple counties that are also in the mix. They are smaller counties. What I heard from the governor's office yesterday, and I think, JT, this might have been on the call. I don't know if you were on the call yesterday, but that both caucuses had, is that the larger counties did not, they want to work out maybe some different standards that were even in addition to the 3 weeks or looking at something different. But they, what I heard from the governor's office is that some of them were asking for just larger counties not to consider any reopening. But so anyway, that standard has been met. It has been met by a number of counties. It will be hard, and I'm assuming everybody understands that the whole reason for the 3-week wait is the same as the phases, that it takes 2 weeks for the virus to actually show up in people generally. And then you need some period of time to look and see if there's been a significant growth in transmission before you do a reopening or you move to another phase. So that's the public health reasoning for it. I think people could argue back and forth about it, but again, I was actually quite surprised to see the number of counties that have actually already today were just approved to move to phase 2.
Yeah, and I will weigh in a little bit too. I was told by the governor's staff a week or so ago that for larger counties, they would look at something that was more of a per capita standard rather than, you know, a number of 0, for example. And I do understand the background to the 3-week part of this. I think one thing that happens in this whole discussion is it becomes, you know, a straw man versus a straw man. You know, and the governor has not locked down the entire state, and those that are wanting to consider how can we get more of the economy going are not saying let's forget about public health. And we've got to somehow break into a more nuanced discussion so that we can move forward and have some trust for the people of Washington. One thing that I have been urging the governor's office to do from the beginning, and I don't know if he's considering this at all, is as we look at these stages, can we also use what we've learned from you know, a lot of what we've defined as essential businesses operating for the most part pretty safely. Now, we've seen some examples of some essential businesses that have had immense outbreaks of COVID. So let's learn something from that and realize that it can go very, very wrong. But in other cases, we've seen the grocery industry, for example, operate with kind of an increasing cascade of precautions that has kept that in general, not totally, but in general, a lot more safe. And so can we figure out how we can have more and more businesses operate more and more safely and understand that this is not a binary choice. I really agree with the governor when he says it's a dial, not a switch, but every single piece of the economy can also try to be much better in terms of preventing people from getting sick than they are now and than they were back in February.
Great. We have a question from Commissioner Dean over in Jefferson County. And since I passed a lot of the questions to Speaker Jenkins, Representative Wilcox, I'm going to give this one to you first. As county governments, we are currently under a myriad of order and guidance from the governor and health officers. What do you think the legislature's role will be in response and recovery? And how can counties work most effectively with you for our constituents? And, you know, we talked a lot about special session already, but perhaps even kind of thinking farther into the distance into January of next year.
Well, that's a really interesting question. You know, I think we're going to have to figure out what the interface between the governor's powers are and the legislature. And again, I think we're at a moment in history where we really need to work hard on building confidence among the people that we represent. And we do that, I think, by operating our government as much according to you know, normal standards as we possibly can, and as little using emergency powers as we possibly can. That doesn't mean I don't agree with the speaker when we talk about when we convene, how do we figure out how to do that very safely. But I would like the appearance to be as normal as it possibly can be under the circumstances. And, you know, one of the interesting things that could happen going forward is, the truth is, we agree, I think all parties agree with an awful lot of the substance of these exceptions to current law or current regulation that require the four-corner signatures. In fact, a lot of them Republicans would prime sponsor. And so one way that we can go forward is when we are in a session, whether it's a special session or a regular session, we might just turn a lot of these into regular laws that are effective immediately. And that way they're not emergency orders anymore. I think that would be kind of a nice bipartisan way to move forward. And a whole bunch of them have to do with getting rid of duplicative regulations, whether it's on agencies or counties or businesses. You know, going forward from there, the legislature, again, will have to figure out what is this interface with the emergency orders. And I hope that we can join with the governor and have as much, three-branch government as we possibly can, because I think that's a lot more healthy for the people of Washington and their confidence in their government.
Great, thank you. And I know from the WASAC perspective, those emergency orders were very interesting and ripe with opportunity from our perspective. So very happy that you touched on that. Speaker Jenkins, anything else to say to this question?
I mean, I guess I would just say that, we're living in incredibly exceptional times right now. And maybe I'm just being too hopeful, but I would hope that we're not going to, every year or even every 5 years be faced with a global pandemic. So I think it's always important for us to think about what is teaching us a lesson for ongoing operations, and when should we be learning a lesson that we are in an exceptional circumstance and should do exceptional things, right? So I think that's one of the big things that all of us have to think about as elected officials right now. And I guess I see a lot of times people learning the wrong lessons from things, and I do that myself at times. So I'm trying to be careful through this to really be thinking through what are the right lessons to be learning. In terms of collaboration, I think about this less in terms of the proclamations, but more in terms of for those of you who are in elected office, in 2008, 9, 10, 11, and 12, JT and I were elected the same year. So we came into our first legislative session in 2011, and we were still suffering really severe consequences from the Great Recession. We have to find more, I think, creative ways to work together in terms of both revenue and spending than we were able to do in the Great Recession. I think we ended up kind of counties and cities and state government playing off of each other in terms of either the state got the revenue, or the county got the revenue, or cities got the revenue, and who got how much. And there's certainly always going to be some of that, but that's we probably should try and take, I think, a larger step back and think about the residents of Washington and how they can best be served. And I do think, a lot of the answer to that is serve people locally. There's a huge role for state government, a huge role for county and for cities, but we're going to have to really think long and hard about how we make it through this next economic downturn, because I think it's going to look quite different than the last one.
Great, thank you for that. I always like to put Eric on the spot to ask the final question. So Eric, as Executive Director for WASAC, I'm leaving you with the final question and the wrap up for our speakers. And Eric, if you can raise your hand so Mitch can unmute you.
Eric, you might have to press *9 if you're on your phone rather than on your computer.
All right, he should be unmuted now.
All right, this is Eric Johnson. Can you hear me?
Yes.
Great, thank you. So both speaker and minority leader, we appreciate you being on the call immensely. We have been working with some leaders in your caucuses, Representative Gaynor and Representative Poulette in particular, to look at the needs that we're going to have going forward. And you talked a little bit about those, which was revenue flexibility, as well as suspending certain obligations, things that we perhaps don't need to do right now. And I guess we've had commitment on the part of committee leaders before, but we've never really gotten the firm commitment of leadership. And I think that's really our outreach right now, is to really ask for your views on committing to giving us some unprecedented tools to work through at the individual county level to meet the demands of both the expenditure and revenues that we know. We know we probably are going to be in a 20% revenue reduction in many counties, and that's unprecedented. So we're going to need some variance from the things that we've done in the past, and just really not putting you on the spot, but really get you to think about and respond to the work that some of your committee leaders have been doing. And are you going to be willing to commit your caucuses to that as well?
Well, that's a tougher question for me, so I'll take it on first. And when it comes to something as fundamental to what a lot of my caucus members believe as taxing, they would not be bound by any commitment that I made. So I've always tried to have an open door on this and listen as sympathetically as possible, especially work on things like the division of revenue from things like alcohol and cannabis revenues. Ed Orcutt feels really strongly about this, and he is the policy lead. And, he works closely with many of you. And I do agree with what Lori said. These are extraordinary times, and you can't just be bound by a position that you had a year ago. This is a very, very different world. And I would urge all of my caucus to open their minds on these issues, but I'm not going to commit them to anything right now. That would be foolish, and I wouldn't be able to keep my word to you.
I would just say I think that the work that Representative Paulette is doing, especially on the supplementation issue and the flexibility issue, our caucus has had some conversation about it. And, I, like JT, I can't make promises because it really depends on exactly how a proposal ends up looking. But I would say that generally that the reason he's working on that is because the House Democratic Caucus is supportive of exploring that. I'm supportive of exploring that. I think as we look at relaxation of other state requirements, I guess one of the things that I would caution about is things start to, I think, feel very political to folks, to me, and I guess I'll just say to others in my caucus, when we start to see on lists, and I'm not really talking about lists that you all sent, but these are just examples, lists that other people send of things that we could do to really help their industry. And they're honestly like bills that have been proposed for the last 5 years that have not passed for varying different reasons. Probably not the best way to go about it, right? That kind of stuff. So really, when you think about relaxation of state requirements, I would make sure to think through kind of what are the standards you're applying for something to get on that list, and be clear, about what those standards are and how this thing that you're asking for meets those standards. And then, be engaging, especially with those on the local government committees, to get feedback from them. The reason they're leaders on those committees is because our caucus trusts them to work these issues, or at least on my side of the fence. So working with Representative Paulette and other members of that committee, I think is a great way to start making sure that you have buy-in from a caucus.
Great. Thank you, Speaker Jenkins and Representative Wilcox. Much appreciated. Thank you for giving us almost a good hour's worth of your time. I know you guys are very, very busy and have a lot of things on your plate just as much as we do too. So very much appreciated, and thanks for joining us today. And feel free to stay on the line, or if you need to jet off, understand that as well. Thanks.
I'm going to hop off, but I just want to wish everyone a happy Mother's Day, and stay safe and stay healthy, everyone.
Yeah, I'm going to get off too, but I just want to thank you all for sticking with this. This is the hardest time to be a public official, and so much is out of our control. And you know, all the good public officials feel responsible no matter what. And I'm glad that so many people are working hard, not giving up, and you know, especially at the local government level where you really can never hide, and you own your results more so than anybody does at the state. You're just critical, and I thank God that you're there.
Great. Thank you both so much. And we look forward to special session, and we look forward to working with you during that, as well as getting ready for January. Much appreciated. Mitch, if you would be willing to forward us on to the county variance slide. There we go. Thank you. I want to give you guys an update on this, and really this is last minute update. We updated it twice within the governor's press conference, so hopefully this is as recent as and accurate as possible. As you can see, of the 10, we have a number that have already submitted plans and a number that have already had their plans approved, which is really great. I will note 2 things on this map. Stevens, although they're not part of the original 10, they are working with Ferry and Pend Oreille counties because they're part of Northeast Tri-County Health District, and so they're kind of highlighted just because they've been partnering through that process and really adopting a regional approach to their reopening strategy. And then Kittitas County was our first county to apply for their variance, and it was going through the approval process, but given recent events, just kind of hitting pause to make sure that they are in a good position to respond to a recent positive case in their jurisdiction through that planning process. So that's where we're at. I know Wahkiakum submitted their plan, and I believe Skamania submitted their plan today. So in the next couple of days, we'll probably be hearing about that. And Jefferson and Grace Harbor, I know that you've been having some very big conversations with your board, with your health department, with your community on whether or not to pursue a variance as well. And so I know that you're working through that issue as well. Go ahead and move to the next slide, Mitch. So just an update on kind of that plan review process. Core elements that demonstrate the approach and ability to adapt and respond. That's what the Department of Health is looking for those plan approvals. We have sent out a link several times, and we'll probably keep it as an ongoing resource for you with the COVID daily email, so that you all can see the plans of your fellow counties that have submitted. So you can see kind of what's been working, what they've used, how they've framed their plan, and what they've included in their plan to for approval. Once submitted, it's been taking around 3 days for approval. I will say around 3 days. I think the first plans were submitted on Monday or Tuesday of this week, and so that 3-day mark is about right. There's a lot of local considerations and issues that are continuing to be raised. I think the big one is out-of-county travelers and how to keep people who are not living in a particular county from heavily trafficking and visiting that county. That's an ongoing issue, and I know many of you have adopted local resolutions prohibiting vacation rentals or Airbnbs, or closing public access that you control that are county roads or things like that. And through phase 2, you can continue to do that. So phase 2 doesn't mean that you have to follow everything outlined in phase 2. You can be more restrictive if you want to, and you have that ability with local control. Regulation and enforcement, again, is an ongoing question and issue. For the 10 counties that are going through this process, hopefully this week you got an email from Eric inviting you to our learning meeting that we've been having. We're going to have that again to help us work through some of those issues. Guidance for phase 2 is forthcoming. I think that's a really important thing to note that we learned kind of after a lot of you started down this variance process, is that businesses within phase 2, once your plan is approved, need that local guidance, or that state guidance rather, excuse me, that state guidance in order to open safely. Phase 1 guidance is finishing up this week. We've had a commitment from the state that phase 2, that guidance will be coming next week, and they will be pushing out guidance as soon as it's done. So you'll probably, instead of seeing all of phase 2 guidance happening once, you'll probably see that being added as it's piece by piece and business area by business area as it's getting finished. But we'll make sure that we keep you updated on that, especially those counties that have had those approvals, because we know you have people within your counties that are so eager to see that guidance so that they can open up. The question of adding additional counties to the eligible list, that is an ongoing conversation that we've been having with public health and the Department of Health, in kind of identifying what other criteria or different criteria could be used to help other counties maybe become more eligible or move on to that. It's an ongoing conversation. I would expect that criteria to be a little bit more responsive to our situation as we move in phase 1, and we're in phase 1, and we continue to see things move forward. So that's an ongoing conversation and a lot of work being done. Hope to have more information for that soon for you all. That was a really quick and dirty variance update, but hopefully informative. It's an iterative process. We know it's constantly changing. We hope that we can keep you guys informed as we move through that. General COVID updates. Melanie, I'm going to turn that over to you for open public meetings and PRA, if you want to give any more updates on that. And then Eric, I'll let you do a quick update on CARES, and then Melanie, I'll let you turn it back over to the state work groups as well.
Okay. And then Jamie, while we're talking about this, maybe to check those Q&As and make sure we got everything. Because I think there's probably some questions in there that you'll be able to answer that weren't appropriate for the legislators. Regarding the public meetings and PRA, you heard really what the issue was from the legislators. As I understand it, with the PRA, the Republicans were comfortable with extending that for local governments, but wanted additional information about why they needed to do it for the state. And from the governor's staff's perspective, he can't just change the law for one group. He can only change it just in its entirety or not at all. So that's something that they'll need to be working out. And I didn't get the impression that it's really a problem for us though, but it will have to be re-extended on the 11th of this month. It appears to be only the section related to the 5 days within which you have to respond to the initial inquiry. And so if they're not going to waive something, that's probably the best piece, because that's probably the easiest piece to respond to. But we'll see. I think they can probably get there on that one. And with the OPMA, there was some confusion because the PRA and the OPMA are in the same proclamation order. The governor's office didn't want to put out a new proclamation. Some people thought that meant that it didn't take effect. From the governor's office and the attorney general's office perspective, all they felt like they needed was the letter from the legislature saying they agreed to extend it. So they have done now an extended proclamation, so that question is moot. But at the beginning of the week, we did see some differences in how counties and cities were reacting to it because of that confusion. But I think at this point, everything is as under control there as it can be. Do you want me to skip ahead and talk about the government services really quickly, and then we can just let Eric talk about the CARES funding?
Yes, that sounds great.
So, and correct me if I'm wrong, Jamie, but I believe that it's phase 3 where the open or public facing government services is reintroduced, or is it phase 2?
It is in phase 3.
Okay. So when we saw that, there was some confusion over what they meant, because there's a lot of government services that you're already doing, that you have to be doing in order for there to be construction or for people to be paying for things and whatnot. So we were trying to figure out, what did they mean by phase 3 versus, and what are we doing now in phase 1, and so on. And there's a group of staff from the governor's office that's committed to understanding what you all are doing now and what can be done now, say, versus what needs to be more of the pure public facing, and what does it mean, what does it look like. And we will be having conversations with them over the course of probably roughly the next week. We had an initial conversation on Wednesday, I think it was, maybe Tuesday of this week, with the idea that we would be getting back together either in writing or over the phone or something for further discussion next week. So that's happening. Not really a lot of clarity at this point, other than what you're doing now is okay. It's what you need to be doing, but further clarification is going to come. And I had mentioned on a call with the administrators earlier this week that they were talking about putting together some work groups and doing some direct Q&A with you all, that given the scope of everything that they're working on with all the phase 2 requirements and stuff, they felt like they don't really have time to devote to that. So we will be working as the intermediary there. So what I did tell the administrators earlier in the week has, as of today, been changed, but we will be communicating with them and we will be communicating with you. So we will get it sorted out before we get into phase 3. I did see a comment from Commissioner Gilder, and I assume you're talking when you say, but some would like it to be in phase 2 about the government services. I think I would refer to Jamie on that because she's had more of the conversations on phasing, but I haven't heard any discussion so far of moving it into phase 2 from phase 3.
Yeah, I haven't heard much on that. I think the focus has been on just clarifying what that means and what services that would be applying to that haven't already been implemented because of the necessity to address other businesses in phase 1 and phase 2. So we're working on getting clarification for that, but I know that it doesn't necessarily make sense for it to be in phase 3, and that was one where we felt that a lot of flexibility could be used. My guess is that it's really reinforcing funding, and the reason it's in phase 3 right now is that it would be more customer facing and trying to get things in place like sneeze guards and barriers, so that the public, should they come in without masks or things like that, your staff are still protected. But that's one big one that's a work in progress. So stay tuned. And then I've remembered that Eric texted me earlier about CARES funding. And so I can, let me just briefly say that there's been an updated FAQ and a link that was provided in a COVID update. We'll probably continue to send that link out as well for you guys. I know we've been fielding a number of questions about what, could eligible or approved expenses be with CARES funding. We do have a funding discussion date. Instead of TBD, it is Tuesday of next week from noon to 1:30, I believe. And that is really a way for you all to come together, share ideas of what you all are spending your CARES funding on, as well as kind of talk through some questions that you all might have too. So again, that is Tuesday of next week is we're having that funding discussion, noon to 1:30. Let me just touch base on a couple more questions that are in the question and answer before we end. There's a question about masks, hand cleaners, PPE. We need to be able to make consumers and employers feel confident. Yes, that is a big question. I think, the PPE pipeline is an ongoing issue. Masks, PPE is really the N95 masks. That would be something that's going to be reserved for our healthcare and first responders and really the medical side of things. But other masks like cloth masks and surgical masks are intended to be more for the public. I know there's a lot of different counties that have started doing kind of matchmaker with church groups and other groups that are making masks, a large number of them, and helping connect them to agencies to help distribute them out to the public. So I think that's a really exciting avenue to explore more. Hand cleaners, those kinds of things, that is one of those things where if you can get it and you can purchase them, purchasing them to make sure that when you're ready to up your cleaning practices for the public, you have that in place. A question about Mason submitting an application. I believe that is in process. Last time I talked with my local health department director, and so we'll probably see Mason submit an application. I know they are working with the Department of Health to get the green light to submit that. And then a similar comment from Whitman County. Yes, I believe they've also worked with the Department of Health to kind of get the green light. Again, the new criteria or any different criteria, that's an evolving situation. And so, I think the important thing is to make sure that you're connected with Department of Health and encouraged, whatever the situation is, encouraged to apply once, kind of connecting with Secretary Weisman and making sure that, your county is in a good place to do that as those criteria evolve. So that is all I have for today. Mitch, if you want to take us to the next slide. Any final questions? I'll give you guys about 30 seconds or so to type it in.
It looks like Brian Shin has his hand raised.
All right.
Are you able to hear me?
Yep.
Okay. I guess it's twofold. Number one, are these sessions every Friday meant for us to listen to you talk or for you to listen to us? I would like to see more interaction. And I think that the questions that those legislators, I really appreciate them taking time out to come here, but I think they should answer those questions. Part of our problem, many of us feel out here in the counties, is that the scientists in the lab are making the decisions, the elected officials need to make the decisions guided by scientific information and data. So I think it's very important that those two legislative leaders get a chance to answer the questions. And I'm sorry, it got me cranked up here, but I think one of the things that should happen is this should be managed on a regional or even local county level with state guidance. And that's not happening, and the lack of success is showing it. Thank you.
Well, I didn't really hear a question in there, but I would just say that the idea of the regional opening has certainly been raised with the governor's office. And I think it's important to remember that it's not the legislators who make those decisions. The governor, in his emergency powers, has that obligation. And so, I mean, you do see some regions just because of you know, the health level and the size of the counties there. So it's happening organically in some areas, but I think we need to make sure we're directing those questions to the people who can actually make those changes. I would also say that I wanted to remind everyone who is working on the variances that we do have the conversation scheduled for Monday afternoon, where we can walk through some of the questions and concerns that people have as they're moving through that. So we talked about the reminder or the announcement of the call on Tuesday, but I wanted to make sure that people didn't forget about the call that we have on Monday as well, because we're having so many of these. And then I would also just say that these calls have been kind of a mix of hearing from you and you hearing from us. When we first started them, they were really more of a round table conversation, and people started asking for additional information, and so we started providing speakers. But certainly if people don't want to have a speaker and they think it's more helpful to go back to that round robin style, that's of course the type of input and feedback that we're looking for. So these are meant to be helpful to you, and so we would we'd want to hear from you on that.
All right, Eric, I saw that you had your hand up and then you lowered it. Did you want to say something? I know you're on the phone.
No, I'm good. I think Melanie captured the essence that we certainly, we take lead from the members. They asked for us to start bringing some guest speakers in, so there was more talking at you than the roundtable discussion, but we're actually happy to either extend this so that there's more opportunity for member exchange, or we can schedule presentations like the one we did just now at a different time and continue to have this. So there's many options. We've started targeting very specific sessions for the members as well. For example, we're doing just one on the CARES Coronavirus Relief Fund next Tuesday from noon to 1:30, where that is going to simply be the opportunity for members to exchange ideas and information. We'll do a little bit of discussion. Obviously, we do the roundtable discussion now for those counties that are eligible for the variance, or those that might become eligible, again, targeted to those counties where it's them talking. So we're happy to facilitate this Friday afternoon call in the way that the members want.
All right, thanks, Eric. Any last thoughts? We are a little bit over time. My goal was to get us to 4:30, and again, I missed the mark. Any final thoughts before we end it for the weekend?
I would just say that Commissioner Trask said in the Q&A box that their variance will be complete by Monday afternoon, so that's great news. And I wanted to make sure to wish everyone a happy Mother's Day this weekend.
Likewise, if you are a mother, happy Mother's Day. And if you can call your mother and wish her happy Mother's Day as well. Thank you all and have a great weekend.